Whalahi atu, te ao whakatapu moi hao whangani. So just like to acknowledge you, Dr. Amio, and my esteemed panelists for bringing us here today in this wonderful webinar. And I'd just like to share a little bit of the work that I'm doing. So thank you for giving that introduction to my background. I'll just share a few slides. One moment, please. Okay. Okay, you can... Okay, Amia, can you see that? That's so clear? Okay,
Perfect.
beautiful. Thank you. Okay, so I've been, I'm very fortunate to have a Heart Foundation and Putahi Manawa Fellowship investigating heart failure for our Pacific peoples. And I guess it's a topic that's close to my heart. Three members in the family with heart failure, and just been privileged for the past 5 years to be doing some interviews and co-design workshops with whānau. And it's a condition that that really needs a lot of attention. And, there's a lot of opportunities to improve the heart failure journey. It's a chronic condition, and it affects so many of our whānau. So really has a big impact on our health system. So it's just an area that really needs a lot of attention. So heart failure, it's a long-term condition which occurs when your heart isn't pumping or relaxing as well as it should. And when your heart can't pump or relax effectively, excess fluid can build up in your lungs, legs, and other parts of your body. And this fluid buildup can lead to a range of symptoms, so swelling in the legs and shortness of breath. So our qualitative research with our Pacific patients and whānau have shown many areas where we can improve the heart care journey. So heart failure can be complex to manage given the number of medications and therapies. And patients report that they don't always get satisfactory explanations from health services and the providers. So language for Pacific patients is often a barrier for empowered decision making. And with the discharge planning process, often there's a lack of information and support to manage the condition in the community. Patients have shared with us their anxiety of not being clinically monitored on a long-term basis, even though heart failure is a condition you have for life. So heart failure responds well to ongoing management in the community, yet there are known gaps in continuity of care following discharge and significant disparities for our Māori and Pacific whānau. So what we're hoping to do is, by empowering patients and families to accurately and confidently interpret symptoms and to feel confident when to seek care, we're seeking to reduce unplanned hospital readmissions and improve long-term health outcomes. So this is where I'm bringing in my technology background and my health background. So it's really great to bring all these different hats that I wear. Very fortunate to work with Dr. Clarice Chung, who's in Otago, and continuing work with Dr. Karina Gray, who's been an incredible mentor for me. So what we're seeking to do is to develop an AI grounded system. So it's Pacific focused, looking at management of heart failure. And what we're seeking to develop is a culturally grounded AI model that delivers personally culturally grounded post-discharge support via a digital app. So the system centres lived experience and cultural values to ultimately reduce bias and to give clinicians objective, patient-centred, generated data and culturally relevant insights for equitable decision making. So our solution starts where the current system stops, right after discharge in the home when patients are most vulnerable. So we're seeking to use smart symptom check-ins combined with passive wearable data, so your heart rate, sleep, breathing, weight, to build a full picture of the patient's health every day. And by tracking patient symptoms with biometric monitoring, patients can be informed that their symptoms with certain biometric readings are showing early signs of heart failure. So post-hospital profiling can provide real clinical benefits to people living with heart failure, especially in this 4 to 6 week period after discharge when patients are most vulnerable to deterioration and readmission. So for example, if a patient gains 2.5 kilos in 3 days and reports mild breathlessness, The system would detect a risk and prompt action, which might be a diuretic adjustment or clinical, and hopefully avoid hospitalisation. So the development cycle of the project is grounded in the Kakala framework, which is a beautiful Tongan metaphor, where you collect the data, weave the garland, and the important process of providing it back to the community. So co-design is a really important aspect of data sovereignty. And we've been very fortunate in the Manawa Takiwhatu program to have worked with Moana Connect and some of our co-design. So it's come really strong through our engagements that this is an area that's important to Pacific families. So that's helped give us the mandate, because it's been signalled by our Pacific whānau that this is an important area to work on. So the phase one will be to build up our governance group, to understand the acceptability and feasibility of digital health and AI. And then the various phases, so there'll be a development of the AI models using big data, using de-identified and ethics-approved data sets, such as hospital records. Participants will trial the prototype, logging their symptoms and wearable data. And these inputs will refine the language models and context-aware triage support. So all phases will go through ethics, adherence to specific data sovereignty principles. All data will remain encrypted and user-controlled. Phase 3, TUI, which is the model integration and system refinement. So this is where we use our dual LLM hybrid architecture. So this is a hybrid decision logic system. So I'm definitely not the expert here, working with our data architects. So that's one thing about working in the AI space. You really know your limitations, and collaborations are really important. So really blessed to have the expertise in this area to help build this unique architecture. And there'll be a process of gaining the user testing and getting clinical feedback validation, as well as the cultural validation. There'll be a pilot process to evaluate the usability and acceptability. And then importantly, with part of Pacific data sovereignty is the dissemination. So bringing communities and sharing back to communities to ensure that we can translate this pilot into hopefully clinical integration down the track. So we're at the first phase of the project. So this is understanding the feasibility and acceptability from the perspective of patients and whānau. So this has been approved by ethics. So we're just seeking to do some interviews and focus groups, and using the appropriate Pacific frameworks for diverse groups. So not acknowledging the diversity of our Pacific families. So during these interviews and workshops, we'll be trying to understand perspectives on what would make them trust the AI? What are their concerns about data collection? What do people think about video capture, for example? And then through the workshops, we'll seek to understand culturally resonant expressions of heart failure symptoms, and what are the trust building, the language and literacy requirements of our whānau. So my details are up there. There's a contact number. So if there are any if you know families who might be interested in participating, please do get in touch. And that's me in a nutshell. Thank you.
Oh, malo, Sandra.
Malo.
What I love about your project is we've just gone straight into seeing how technology can be used within a health condition, and heart failure is definitely a health condition which affects a lot of our Pacific communities, especially the aftercare, going home, who can monitor our communities when they're at home, when there's no other health professionals around them. So we will also be sharing the details. If you're interested, if you know any whānau that are experiencing heart failure or who have heart failure and interested in being part of this important project, please feel free to reach out to Sandra. And what's really important, Sandra mentioned, that was a collaboration. It's never a single journey, and it definitely requires lots of perspectives and insights in order for a technology or product to be developed. Now I'm going to go to our second speaker now, who's Soteria Uremia, and we're going to go way back to where the journey starts for young people or for individuals who are really interested in getting into this space. And so Soteria, she is a Pacific STEM leader and inaugural co-director for Pacific at Putahi Manawa, which is a centre advancing heart health equity for Māori and Pacific peoples. And she works closely with Sandra. So she founded Pacific Eye to strengthen Pacific representation in research and innovation and champions hands-on STEM programs for underserved Pacific youth through initiatives like Kudos Science Trust and Science Spinners. She's also the Pacific Module Co-Lead alongside myself at Te Titoki Mataora under Meeting Aiku Aotearoa, and her work bridges cultural perspectives with scientific inquiry to support inclusive education and Pacific-led research. Whakataitele lava, Soteria, over to you.
Whakataitele lava, Emil. Talofa lava, mahalo soifua. Thank you for having me here as part of this conversation today. Soteria Yeremia is my name, and I am Samoan, with a little bit of Chinese in there as well. So I'm very familiar with our lovely panel here today. Thank you for the introduction, Emil. I'm going to go straight into my work because this is a very broad area of science and STEM engagement with our Pacific communities. So I have a very multidisciplinary background, have come from a corporate and business history and background in my work career, science and community engagement, and the building of STEM programs to encourage our young Pacific and Māori people to engage in these areas has really been the passion that's been driven by the science programs that I've been involved in over the last 15 years. So I just really wanted to share a little bit about what I've been doing in just a real snippet. And Emil has explained that I'm also the co-director for Putahi Manawa, which is a centre of research excellence, promoting the work being done to bring equity to heart health for Māori and Pacific. And so there's a lot of technology work that's going on in that space that we're funding across lots of different projects. And Dr. Sandra Henchardt's work has been really significant in that area. And so we're really excited to have her as part of our team there as well. So basically, I'm just going to share my screen with you, and hopefully I get this up properly for you. Here we are. So Pacific Eye was started this in the last 2 years. It's really around advancing the pace for Pacific to succeed in careers of science, research and innovation. So my background is really broad across the sciences. However, in this particular area that we're talking about today, we are focused on medical technologies and how technology can enhance our Pacific community's well-being. So that's the company Pacific Eye is a combination of the different roles that I hold across the STEM space. Part of that has been, has come from significantly the work that I've done around the Kudos Science Trust. And I've just put a little snippet here because it could go on forever, but the Kudos Science Trust is an organisation in the Waikato region that celebrates science excellence. And it is profiling science stories and the initiatives and discoveries, the research that goes on across this region and the Bay of Plenty. And from this work has come that we've built off here of the success of these scientists and some of the work we've done with them is engaging our Pacific and Māori young people in science. Having been in this space and only been one of very few, if not the only person with a brown face in the room on many of those celebratory nights, my concern has been that there has not been enough Māori and Pacific young people in this space. So from this came the development of a project called Science Spinners. And Science Spinners is around demystifying science for young people and basically opening up a world of potential to succeed in STEM. And so this was, we were fortunate enough to construct this process because of the fact that we had so many incredible scientists doing incredible work. So we needed to build that strain of our Pacific and our Māori young people coming into these fields. So as I said earlier, my work is very broad. So we'll get to the point of where technology sits in here and how it actually, from these types of projects, can help our young people to really aspire to those opportunities and to view those as possibilities for their own career paths and contribution to our Pasifika communities. So I just wanted to share a couple of minutes video with you and the story of where this particular project comes from. Hopefully my screen is actually showing this in the...
Sateria, could you put it on full screen, please?
Thank you. Right, let me see. Here we go.
Nice.
Thank you. I'm technologically challenged at times.
My name is Sateria Yeremia and I'm the CEO of the Kudos Science Trust. So Science Spinners was born off the back of the Kudos Awards. It was about bringing scientists, industry professionals and experts from around the region together with our schools to try and encourage them into these career paths. We're a program that supports our vulnerable communities, our lower decile schools. Our focus is on our Māori and Pacific students to encourage them and inspire them in science and STEM.
Unfortunately, we're not able to do this in classrooms. So coming to events like this, it makes our work as teachers easier to show them how science is applied or engineering technology is applied in the real world, and opens up their mind too about their future pathways.
It is a really good opportunity for young ones like us to go through workshops and learn different types of careers that we can go in that fit the category under science.
We reach about 38 different schools around the Waikato and Bay of Plenty area, and just recently in Auckland we launched STEM Hub for the first time.
They were so fun. Great.
Our program is not a typical program. It's about supporting our kids to learn in environments that are comfortable for them. We want them to be able to be practical. We want them to see the relevance of where STEM is applied on a daily basis, to be able to encourage them to see the value of careers that are in the STEM pathways.
It was really educational. I was able to explore more on what STEM can offer students. And I feel like we do need more young Māori and Pacifica students and maybe women as well to be invested in this.
STEM is a really crucial part of New Zealand's workforce. In the next few years, we're really going to struggle to be able to fulfill some of those skilled roles. Industry are really coming to the party and supporting the skilled STEM workforce that they're looking for. And so we would encourage them to continue to support the students.
Whawhitai, Sateria. That was a really great insight into the work that you've done, and especially seeing the students who are our future and who are our future workforce, if not already our workforce, that especially in the health tech pathway. And what's clear is, how do we keep providing these opportunities in STEM in general, or STEAM, which includes the arts, so that our students have a greater pathway to choose from, whether it's just going into tech itself or health technology. So thank you for your whakaaro on that area.
Thank you, Emile. Can I just say that, sorry, because I was trying to work my screen out. I really just wanted to focus on the fact that across the STEM and the STEM fields, that this particular area of medical technologies has got a really significant contribution to make. And so basically, even though I've shown you STEM across these fields, it is multidisciplinary, and a lot of these areas relate to the solutions that we're looking for in health technologies. So that's just a good example of where our students come in. Thank you, Emil.
That's great. And a few years ago, we did a sort of scoping review as part of MedTech IQ Aotearoa, looking at the entry points into health tech for our Pacific communities. And there's so many areas, but specifically for our Pacific communities, you're either a clinician, we started off in IT, or you came through as an undergraduate student through university. And there was always a horizontal shift into health tech. So they started off as a general health career or IT, but then they specialize in this area. So even if people are in a career that, you know, they perhaps want to change, there's always that horizontal shift that you can make into health tech, which is great because the next speaker is Candice Belu-Mariner. And Candice is the General Manager of Pacific Health Services Hutt Valley, and it's the only Pacific-led health and social service provider in that region. She's got over 20 years experience in health and community development and is really passionate about health equity, culturally responsive care, and community-led solutions that empower Pacific families. She's also spent some time in Singapore and Malaysia establishing partnerships with tech companies, which I don't want to give too much away, but no doubt she'll share during her presentation. So whawhitai, Candice, I'll hand over to you.
Malofa tai Mio. First of all, just want to acknowledge Moana Connect and Dr. Mio for today, as well as acknowledging and honoring my fellow panelists. Thank you for the opportunity to share some of the work that we're doing here out of Wellington. Candice Belu-Mariner, I'm a mother of two, born and raised in Samoa. I did come on a government scholarship. The Samoan government paid for me to come University of Waikato, did a sports degree, and then went back home and worked for government in the Ministry of Education, Sports and Culture. So, you know, within the education system, in Samoa, sports sector, and in the community development. Then we migrated here. It's been, I've called New Zealand, especially Wellington, home for the last 18 years. And, you know, my career, especially here in Wellington, I worked in primary health care, cross-district health boards, community. So today, the context, I just wanted to give you a little bit of context, not just in terms of my background and career pathway. And I think if there's anyone listening in, particularly around health isn't just clinical. I am an example of a non-clinical health, not just within management, but also health promotion. And we all play, I think, different areas of health, especially and sports and recreation. We're all health promoters. Everyone has a role to play in the system. I'm currently General Manager of Pacific Health Service Hutt Valley, and I will share a little bit of, I will hone in on an AI remote monitoring tool, but I just also wanted to give you a background of how and why we landed on this. Pacific Health, let me quickly share my
Just a reminder to everybody, if you have any questions, please feel free to put this in the chat and we will answer them towards the end of our webinar.
Hi, Anya, can you see this?
Not yet.
Technology at its best.
It always never wants to work when we want it to work.
Okay. So can you see it now?
It's coming through. Perfect. And then just put on the slideshow. Nice. Yep. Good to go.
Okay. So Pacific Health Service Hutt Valley, we work in community and primary health care in the intersection of, you know, we're in the homes, so we deliver in the homes. We work alongside general practices as well as hospital services. We are a nurse-led clinic. When I say we're a nurse-led clinic, we have nurse practitioners, nurse prescribers. So the scope of practice of our Pacific nurses are, at the top of their scope. And one of the reasons why we've been deliberate in doing that, because obviously for all of those who are familiar with our health systems pressures, we looked at the data in terms of Pacific Health workforce nationally, taking into consideration doctors, nurses, and clinical workforce across the country, it's only 2.8%. So as much as we want to, a lot of our clinicians to be Pacific, reality is there's only 2.8% of our clinical workforce, allied health, across New Zealand. We know that our Pacific Aotearoa, we've got an aging population with 2 or 3, we're living longer, but with 2 or 3 comorbidities or long-term conditions. 45%, and this was the data we saw, 45% of our Pacific population now are under 15, which means that we also need to acknowledge that engagement in healthcare is going to change, which is why we've pivoted really fast to adopting technology. Obviously, access and equity gaps, and I think I am preaching to the converted, but I just wanted to give a bit of our background and context. And of course, funding sustainability pressures. And we are still facing, even though there's been a lot of developments and adoption of different technologies within the health system, both out at GPs, primary care as well as hospitals, is still very much fragmented. So for example, when you go to your GP, a lot of them have adopted, for example, Manage My Health. But what we've seen in a lot of there's a very low uptake of Pacific. In fact, in the Heart Valley alone, out of the 25 GPs who have Managed My Health, the usage rate for Pacific in actually signing up and utilizing the app, Manage My Health, you can book appointments, you have your diagnostics, your blood tests come through. It's only 20%. So we know that our people are not actually adopting, or even the uptake of telehealth. So one of the things that we've really as an organization looked at, and this is applying, you mentioned earlier, and this is learnings from overseas. So fortunate to have been able to travel to Canada, Singapore, Malaysia, and looked at some of the things that are working overseas that we could adopt, taking into consideration that, while we may have the latest technology, it's the people behind the technology. And, that's the intelligence, right? And so looking overseas and, networking, I think one of the things, and Dr. Sarah Soteria, and I'm sure all of you would agree with me, when you do leave the shores of New Zealand and you look at more advanced countries, it's like leapfrogging 20 or 30 years ahead. But in saying that, one of the things that we did find out, it took us to leave New Zealand to come back, and there's actually a lot of work that's been going on in Middlemore, like the use of portable ECGs, for example, for cardiologists to monitor people 30 days after surgery. So there is a lot of technology and a lot of work in AI happening in New Zealand already. But I think one of the things is that it's very much driven in the hospital. It's very sick care focused. It's not about prevention. It's always around treatment when people already have a condition. And so what we saw in Singapore, for example, this is why we adopted this, because the SpeedBack. So SpeedBack is a remote monitoring. One of the things that really impressed us was it was the elderly who were using this. It was the elderly at kiosks, and there were people in these polyclinics that we saw that were actually pressing the buttons and pressing the right buttons and doing all this on their phones or the kiosks. And the more we delved into it, it was like it was a Pacific frame around village support. So the creator of Speedback, who we work quite closely with, is someone who is a caregiver. She created Speedback because she was caring for her grandfather, grandmother, father, and she would be taking time off work to take them to their appointments. And so one of the things was around how can we make this less onerous, not just on the carer, but also put a bit of ownership and empowerment in the hands of our families in the home. So we are now 7 months into this pilot, utilizing Speedback and actually adapting it to suit our Pacific, not just Pacific cultural models of care, but our Pacific peoples and their realities. So we've started with, when we first started Speedback, one of the things we were looking at is 2 areas. It's about optimizing workflows for our already stretched workforce, health workforce, tick. Number 2 is how can we engage our families to have better control of their health in their homes, so that when the 2 things align, number 1 is so that our workforce, our already stretched workforce, can focus on looking after the more complex, the more technologically, the ones who don't even have a phone, and who live by themselves. So there's a lot of complexity even within our Pacific, the different age groups. And then number 2 is, the family involved in the care. And when patients and families see their vitals, so these are biomarkers. So we've started with diabetes, heart disease, high blood pressure. And every day they are loading up their vitals so they can just take a photo. And one of the things why we went with Speedback is because it uses WhatsApp. So we all know that this is how a lot of our people conversate or call their families back home or utilize. So it's WhatsApp. So they're not downloading a different app. And before, when we started again, our nurses were spending a lot of time on travel phone calls and even just going to take a blood pressure of someone almost every, twice or 3 times a week. In the 3 months, so this is 3 months of data, we're now, as I say, we're now 6 months into this pilot, but this is a 3 months mark. We've now 50% of the time of our nurses and the uptake of our clients. And you'll be very interested in this. A lot of the most active clients are over 60. But that's because it's their granddaughters, it's their daughters reminding them, Dad or Mom, have you done your readings for this morning? And the AI, the chatbot, is trained so that we send out a message, a reminder. Hey, Candice, don't forget, hopefully you're having a nice day. Don't forget to take your metformin, for example. So these are some of the nudges, because again, our people sometimes forget, right? We're busy. So this is one of the things that we're applying here in Pacific Health Service Hutt Valley here in Wellington. And again, we're going to scale this up. We are in pilot phase, and we've got 1 more month, and then it just becomes business as usual. I'll just leave it there. As I said, this is one of the solutions that we're looking at how we can contribute to reducing some of those pressures on the health system. Sorry, Emil, one last thing. I don't have it in my presentation, but other things around point of care testing. We've adopted point of care testing that we can take out to our outreaches, where we can actually test people's lipids or HbA1c. So that's around getting the pre-diabetes, so that we were able to see people and prescribe or put them on not prescribed medications, put healthy lifestyle, give them the education. And then the second thing that we're already doing is around cloud-based systems, where we can prescribe our nurses, whether it's a sports field or from a church hall, we can prescribe directly to their nearest pharmacy. So it's about making care accessible, timely for our people.
Whakatai, Candice, thank you for your presentation. And it's highlighted key things, especially around how you can make care easier for our Pacific communities who engage with health services. And what's great is to hear our elders are using your technology or using the platform, because often we talk about the digital divide and we think about how our elders aren't always able to access digital tools based on the ability to be able to use technology. So it's great to hear that you've got good uptake. And it is true around, if people are reminded, they will then use the technology, and that just provides a subtle nudge for them to be able to continue monitoring. And our communities are great anyway, because those who have people who experience diabetes in the home, they're very compliant with testing using a blood glucose monitor, and so they're already recording. And this just elevates it one step, where they're recording their results within WhatsApp, which is then sent back to Candice's team, goes onto their dashboard, and they're able to have that reciprocal monitoring. So thanks, Candice. We'll keep the questions coming through. The next speaker, our last speaker on today, is Veilahi. And if you were at the MedTech conference, or MedTech showcase last month in Mangere, you would have seen him showcasing his work. Veilahi is a son of Nanumea from Tuvalu and Kiribati, and is currently in Porirua. He's graduated with a Master of Design Innovation from Te Kura Hohoa, which is a School of Design Innovation at Victoria University, and he is now embarking on a PhD. As a Pacifica creative, he specializes in using virtual reality to preserve the cultural heritage of Nanumea, combining design, research, immersive storytelling to create projects meaningful to his community. And we've talked about AI, we've talked about STEM, now we're going into virtual reality, and we think about health, it's also well-being, which is how people feel connected to the land, to their culture, to language, which is what Veilahi would be explaining. So I do know that the internet is a bit on and off where he is, but I'll hand over to you, Veilahi, and then we'll see how your internet connection is holding up. Whawhitai.
Whawhitai, Amio. Thank you for my slow connection. It's the uni Wi-Fi. Oh, yeah, it's pretty useless. Oh, my introduction. Yeah, my name is Veilahi, and I just did my master's in design innovation, and yeah, and I really want to showcase some of my work for the community in Tuvalu, in regards to Nanumea, my island in Tuvalu. Yeah, I have one poster, so if that's okay, I'll just talk about the poster I presented up at the exhibition up in Mangere. Oi. And share screen, is it?
Share screen.
Yeah, yeah. Oh, sweet. Oh, can you all see that?
Yes. Might
Hello?
need to zoom in a little bit.
Yes.
But yep, and see it.
Okay. Yeah. Okay. Yeah. I'll zoom in. Yeah. Sweet as so the whole initial idea of this research thesis is called Alam Aotearoa, which translates to sharing ancient stories as sea level rise. Pretty much problem is Tuvalu is coming across challenges in regards to climate change, most specifically sea level rise, and for me, being a newborn Tuvaluan, was like, oh, just seeing all these advertisement and also what the government of Tuvalu is looking at, the first digital nation uh, in the Pacific or pretty much in the world. But for me, oh, so that much about it, I was like, oh, I do have a design background. Uh, um, technologies around this field, and I was like, um, preserved to Tuvalu. So that research island, uh, church, Tuvalu, and also the second Hinga Muna is the cultural house where it comes and gathers.
Oh, sorry, Veilahi. I know the uni Wi-Fi isn't great, so we're going to continue on, but it's great that you were able to share. For those who were able to see what you could during that time, in short, Veilahi's work was using virtual reality, went back to Tuvalu, and he went back to Tuvalu to help document the cultural artifacts, so such as the churches, and he was using that to help capture all of these cultural artifacts in the event that because of climate change, if these cultural artifacts are no longer in existence, then there is a record of that in virtual reality, which allows people to see it. We're using the glasses, and this is a great way to help preserve culture. And when we talked about well-being, we think about the Whanawhale model, our culture and our environment contributes to us as a person and is part of our health and well-being. And this is one of the churches in which he was able to document using virtual reality and allow people, especially though our elders who perhaps haven't gone back to Tuvalu, allowed them to experience once again what it was like to be within this structure. So thank you again, Veilahi, for trying. And again, technology is not always our friend. We always, we rely on it heavily, but it's not always going to be kind to us when we are needing it in times. And so we've got his elders over there. So if I get you to stop sharing, Veilahi, but what we're going to move on to now, I've seen one question in the chat which says definitely around a low-tech resource that might help in all our work would be a fully labeled human anatomy chart in our languages. So isn't this a basic resource that is well overdue? Agree. And what we see is, you know, these human anatomy charts are already available in our children's books. I know that if you, because of a new background, we've got that already, but in a digital platform, most welcome. You've seen a gap, and that's where innovation is usually developed, is when there's a gap and when people find a pain point or find it difficult either to deliver care, either for themselves in their workplace or with their families, which is what Candice was talking about, why Speedback was developed. They would definitely be great innovators. I've got another question from Isabella Smart. Be in contact with Candice. Yes, please, Candice, if you could put in your contact details, or we can in the chat for everyone to see, and then they can contact you directly. So I just have a few questions around just around like what inspired you to be in this space or to use technology. So what inspired you to work in technology like digital, medtech, or AI? And how does your Pacific identity shape your work? So this is for anybody. I'm going to start with Soteria then, because Soteria is in STEM, and then looking at our future generation, especially our children. what made you go down that pathway? What made you focus on that area?
Thanks, Amiel. Thanks for the question. I would say that this particular area is not visible. And so because it's not visible, our young people probably don't think this is a career pathway for them. It's also not an area that is well explained or introduced to our Pasifika people to understand what these pathways might mean as opportunities through school. So if we're in our education system, we know that a lot of our Pacific kids or our Pacific students are generally streamed out of science and STEM subjects. So that in itself is inequitable, but it also doesn't give us the opportunity to excel in those spaces. So what's inspiring about being in this place is because I love solving problems, and I love it when our people can solve their own problems. So I think that if we can share some of our knowledge and our experiences with our community to help generate that excitement, that curiosity, that they also possess those skills themselves, I think that this is actually a really good path for them to, to be on. This is why we're in this space. We're in this space to share this information and to share knowledge and not hold it. So this is why I think we're in these places as part of our service to our communities.
Absolutely. Yeah. Sandra?
Thanks, Amio. Yeah, I think I might just reflect back on some time I spent in Malaysia. Nice to see Candice, you spent some time there as well. Yeah, so I was involved with a lot of community building activities. I was running a group called Big Data Malaysia. We eventually grew it to about 8,000 people, and it was just lots of workshops, lots of knowledge sharing, very informal setting. And there was a lot of investment from the government in workshops, building capacity. So they had all these accelerator programs. And in Malaysia, they've got the Bumi Putra, the indigenous population, and Malaysian Indians. But it was a lot of capacity building, a lot of support from the government, a lot of ground up grassroots activity as well. And as Sateria said, it's about solving problems. So a lot of the accelerators we had were around solving dengue. So I noticed dengue's come up as an issue in the Pacific, but it was about the solutions coming from community. So I think just sort of tapping into Pacific knowledge, our resourcefulness, our resiliencies, our ability to navigate, we've got the solutions. So that's what helps to inspire me to work in the tech space.
Fantastic. And Candice? Just off mute, please. Come on, Wale.
Sorry, I think it's the same as what Soteria and Sandra have already said around. I think it's not just passion, it's actually looking at technology as one of the solutions and enablers to good health. And I think all of us who've been around for a while, when we keep hearing about Pacific stats or, things aren't working for Pacific, but I think it's because the system doesn't work for our people. So one of the things is how can we bridge that gap by using it's a tool. And as a Pacific provider and Pacific health workforce, one of our, as I said, we work at the intersection of community and the system. So how can we navigate and support our people? Because they've got the solutions. How can we utilize a system, like bridge that gap between system and community impact, but also technology around collective impact. And I think we can use technology to really scale up solutions and scale up collective impact. So yes, and I think that's why we're very, and in the next 20 years, again, I was so excited by Lahi's, because I see that in my own home with my two kids, my boys, they don't really, they're on their technology, they're using.
Yeah.
And so again, that's what I mean. We're shifting the system, because then in the next 20 years, how our young people engage is going to be completely different from how our older generation is engaging with health.
Absolutely. And even last week when we had the MedTech showcase, there were about 300 people who came through, and we had a few schools, especially those who are part of the Health Science Academies. And there are 12 Health Science Academies in Auckland. It's now being rolled out across Aotearoa. But what struck me was when reading the feedback, and I was sharing with Soteria earlier. And so one of the questions we asked the students was around what future technologies would you like to see? But a lot of them said stuff around like, I want to see that digital health solutions for cancer or care for leukemia. In the future, I really hope there's technology or digital health solutions for cancer, or maybe something to do with cancer because my aunt has it. And often, you know, that's the area which drives people to find a solution. And it usually comes from, when I said earlier, around experience or pain point they're experiencing in their personal life, or something that they're experiencing professionally, especially if they're a clinician and there are just things that aren't being, the workflow isn't as easy as it should be, and they find a solution that way. And for anybody who potentially has a pain point or a question or an inquiry that they would like to build on, definitely reach out to any one of us, because we can connect you. We're not the experts, but we work alongside teams, alongside experts. And that's the benefit of technology that's being developed in Aotearoa. There's a big encouragement of building your team around you so that you can push forward a solution that will benefit our Pacific communities. Now, coming to one of the questions in our chat is, what are your thoughts about robots in homes caring for Pacific on their own? Now, we haven't talked about robots, but you know, there's lots of different types of robots. You have your pet toys, which can help with mental anxiety, those who have mental conditions, mental health concerns or well-being concerns. They have these little toys that if you pet them, that it helps reduce your anxiety levels. But perhaps I'll ask the panelists around, what are your thoughts for robots in homes caring for our Pacific people?
I can start, and I guess this is where I go back to what I mentioned earlier around the human and our cultural lens over technology. So we do know that our people love the face-to-face and the touch, and that's the sense of security. So I guess my quick answer to that is it's a case by case. So we know from our young people, for example, we have done surveys with young men, the 18-year-olds, the 17 at school. They would like their consult to be done on an app or Facebook virtual. Our older people, probably that won't work. Having a robot is probably, and also because of our family values, a family problem, unless you're very disconnected, which is, we're also seeing a subsection of our Pacific communities, disconnected from culture and disconnected from families. I guess the quick answer is depending on the preference, but more often than not, what we're seeing is probably robots is not gonna work for our older and more family.
Absolutely. It's a good point, because there is a spectrum of how people either assimilation or acculturation, and it might be a preference for those who have no family connection, but depends on the values that a person has. They may not prefer to use it. Another question, Fatu Monica, interested in the outcome of Speedback and the apps for heart failure management and the impact on self-managing. We have issues with anxiety and limited clinical knowledge to interpret information, such as those who check their own BPs at home, blood pressures at home, and anxiety it can cause people. So interested in how it can improve self-care, but may increase need for contact with health professionals and increase workload. Thank you.
I might start with that one. Yeah, so I think part of the work we're doing is the consultation with clinicians to understand their concerns in this area. So a few conversations we've had is that you know, having some of this data overload, some of the clinicians are worried that, you know, they might miss important signals, so miss a red flag. So there's definitely those risks to work through. But in terms of the remote management, we've been speaking to a provider called Sprightly. They've done a remote management in Hawke's Bay, and they're finding with the remote management, it just helps to overcome things like, you know, geographic barriers and not being able to, if there's no roads or so when you leave hospital, you've got this period where you want to be on your optimum target dose for heart failure. And if you get to it within 6 weeks, you've got much better outcomes. And without remote monitoring, it could take 9 months. So really closing that window, there's significant benefit. And so with the remote management systems, you're getting, you know, continuous information, the patient's filling out survey data, or the apps. So there's all these opportunities for the clinician to be making assessments that they might not necessarily be able to make if they've got to wait, you know, a long period before their patient's able to come in because of barriers such as, you know, transport and things like that. But there's definitely lots of clinical concerns to work through in this area.
Thank you. What about Candice?
And just adding to Dr. Sarah's answer there, I think what we're seeing is more people, once they actually can see their own data and track or trend, it actually gets them to think about, okay, because normally they rely on the GP or nurse to do their blood pressures until they see them for another 3 months or another 2 months. But being able to do it themselves at home, do their blood, and then they track, they actually can, so they're like, oh, it was high, you know, last week, and then when they see it stabilize, it actually, that behavior change and that empowerment. So we're seeing a lot more of that than the anxiety, and just for the ones that are on our feedback. But also the security thing is, it's not directly to the doctor, it's our nurse who it only takes less than 10 minutes every morning where we check into the platform and look at if there's any red flags, because the system will flag if anyone has had a blood pressure spike over the, high blood pressure overnight. And I can give you quickly a couple of examples. Number one was a woman who saw her blood pressure because she was doing it herself at home. It was high for a couple of weeks. Our nurse called, and so together they worked with the GP. It was around her medication. So they were able to change her medication. Another woman ended up needing a hospital admission if it wasn't for her checking her blood pressure. So those are some of the things, some examples, but yes, acknowledge that there will be anxiety. But again, I think that's where providers like us and the trust between your carer, which is the nurse, with your GP and the family.
And it's really important to have that human support alongside the digital. So too often when technology is implemented in clinics or in real world settings, that they often just rely on the technology. So people would say that this tool is really, really great. You can use it, but they forget about the human connection part that's really important to go alongside it. So those that work on technology alone are most likely to fail. But if you have a technology product with the support, which Candice was talking about, you have better uptake from both the patient as well as the clinician, because you've got that reciprocal relationship that allows that support to be there along that new intervention pathway. One thing that we probably are all keen to hear about is artificial intelligence is the new rage. Even though it's been around for many, many years, everyone wants to have an AI product or use AI in their work. But we know that there are some concerns, especially around our data or how it's developed. Just thinking about the work that your Sandra and Candice are doing, how do you ensure that whatever AI tools are being developed, one, it's developed for our Pacific communities with a lens for our Pacific communities, and two, that the data that it's being captured, because data is considered like the new land, that is captured is protected and it's not going to be sold overseas, because Māori and Pacific, our data is very precious. There's nothing unlike our data. So one would be, how do we make sure it's for our Pacific? And two, how do we make sure our data is protected? So I'll start with you, Sandra.
I think one thing in Aotearoa, we're quite fortunate to have a governance body such as NEAG, so that's the National AI and Algorithmic Expert Advisory Panel, to help provide guardrails for how AI models are developed. So there's a process where we register your AI project, and you've got to go through a series of questions to ensure that you've got social license. So whether it's does the community think it's something that's worth developing? Are there benefits as well as the clinician perspectives? So I think, yeah, with AI, we're really needing to address issues in bias and lack of transparency. So I think there's an opportunity to relook at the data. So, for example, with Pacific peoples, our biomarkers for heart failure are different from non-Māori, non-Pacific. So by using data that's relevant to our populations, hopefully this is going to ensure better clinical decision making. With AI models, a key concern is transparency and what's called a black box. So not knowing how the LLM came to its decision. So there's a lot of discussion about what's called explainable AI. So the AI should be able to demonstrate to its users, whether it's a lay person or a clinician, how it came to its decision, and to be able to explain it in a very inaccessible way. So those are some of the issues to me.
Thanks, Sandra. Candice and Soteria.
I think we're just scratching the surface of AI. In terms of as a Pacific provider, again, we will always make sure that Pacific data sovereignty, that whatever technology, whatever AI we use, always has to have a Pacific and Pacific ownership. For things like feedback, for example, the data is actually owned by a person. EHS doesn't own that data, or Singapore, our counterpart in Singapore, doesn't own that data. It belongs to our clients who use it and who give us that permission to have that data. But yeah, I think I'll leave it there. Soteria and Sandra are probably more versed at this than me. It's just like OpenAI. You put your data in, and anyone else can access. So I think we'll always make sure that Pacific data sovereignty is front and center of any decision making we make or adopt.
Thank you. Absolutely, Soteria.
I think it's still an area that is, it has been around for some time, but I think for Pasifika people, we need to spend more time on understanding how we want AI to work for us. So the systems that are already in place now through research for some of our own biomedical markers are not really, they're based on models that are not ours. So we're already challenged with that. So we have to also be mindful of the fact that bringing in something else, a new technology that could potentially work well for us, we need to be able to manage and monitor that specifically for Pasifika needs, because otherwise we're going to have something that really isn't for us again. And so we need to make sure that that is a focus.
Like any research or project, it's really important that Pacific are involved right at the beginning, and that allows individuals to shape what potentially could be a positive output or a negative output. But that only happens when we have that lens right from the beginning, as opposed to be coming into a project in the middle, or perhaps at the end as end user testers. So I think encouragement, if there's anybody out there that's interested in delving in AI or digital health technology development, be involved right from the beginning. Don't come in middle or as a user, because it's really important to have that lens right from the beginning. One of the other questions that I have is thinking about what are some exciting medtech opportunities you're currently seeing, you see emerging for Pacific peoples, if there's anything.
I'll have a little crack on this one. I think that this particular area, we don't know what we don't know until we know, right? So I think for our Pasifika communities, just even thinking on problems that impact us, our chronic diseases, the key areas that we're really highly represented in are, you know, areas that we have our own knowledge and background, you know, from our own cultural backgrounds, our Pacific knowledge, our ancestors, our generational wealth of knowledge, you know, and using that to actually help inform some of the solutions that are being developed now. So I think if you've got that, if we can have that Pacific voice and across these spaces, the development of technologies that are being supposedly created to assist our communities and respond to health problems will be more informed and more custom built for us. And I think that's really why it's so important that we expose, you know, not only our young people into these pathways, because they're going to be the solution holders. You know, I think this is why it's so important that that is all part and parcel of what is going on in the technology space. You know, we have all of the tools and the, you know, the technology when we're in the hospital and we see these incredible instruments, but do they fit us? Do they fit what our needs are? Are they going to be able to be used in a way that's appropriate for us? So it's all of those things that is why it's important to have those specific voices in there.
That's fantastic. And even thinking about, so Sandra, with you have another hat, just as we all do, we have lots of different hats we wear, but you are on the digital council of within Health New Zealand Te Whatu Ora. What are some projects or emerging projects that you're seeing coming out when looking at all the projects that come through your rōpū?
Yes, it's been great to sit on this group for the last couple of years, and so the group's part of our role is to ensure digital projects uphold Te Tiriti and have, you know, whānau voices, Pacific, rural, disabled, and it's been really nice in the council that we've got clinicians and whānau sitting together, and often we're singing from the same song sheet and we're backing each other up because they're on the front line and we're so that's been really nice to be on the council. So what we've tried to do is just to, when projects come through, help to see through unintended consequences. So for example, there's something called open notes. So that's where patients can see all the clinical notes that a doctor takes. So it sounds, you know, it can be empowering too, because you're seeing the information and part of that decision process. But a consequence could be that, you know, there's certain types of information that you'd want to hear it in person directly from the provider. So if it was a serious diagnosis, rather than see it on some portal, it's the kind of information that you want to hear in person. So just to think through those types of scenarios, you know, and obviously digital inclusion. So I think with the council, one of the programs was the Net Zero program. So being able to access health information without needing any, you know, data costs and things like that. And more recently, there's lots of collaboration between the clinical networks and the National Health Data Platform. So that's just to make sure that we've got all the infrastructure that we can for robust monitoring so that we can improve our services. And part of being on this group is bringing that Pacific lens. So for example, when we can help to delve deeper into some of the KPIs. So, for example, DNAs for first time to specialist assessment, where we can say, look, there's lots of social determinants why patients might not make those appointments. So there's numbers, and then being able to delve below it to tell you the story behind the numbers. That's important part of the role being on the council.
That's fantastic. Now, just as we are near, oh yes, Candice.
Can I also add what was so exciting? And I know New Zealand is doing a bit of work here, research around the use of genomics, predictive analytics and genes. When just going back to the earlier question around cancer, I won't labor that because that's on. But one of the things I saw overseas was around the use of the genes and to predict people's, not just around the screening, because we still don't do enough screening for, but not just around cancer, it's around long-term conditions like diabetes and the predictive analytics. The other thing is around, and I've seen it at the district health board, around looking at ED admissions, and there was a little bit of work pre-COVID, and then everything stopped. So I think the pace has picked up again after 5 years after COVID. And if we didn't have COVID, maybe we will be a little bit more ahead in some of the research and the developments. But one of the things is around predicting family engagement. So, for example, there was work that was done around a family unit. You see mom, dad, they all come into ED or see their GPs at different times. But if we were to use technology and AI to sort of like predict, then we could actually put things in place for that family, because they come in as individuals, right? But then we can actually, they're not individuals, they're a family unit. So we can do more preventative stuff in their homes and deploy the more appropriate services, going back to the social determinants of health.
Absolutely. And creating a new model of care, which involves digital predictive monitoring and diagnoses before that hospitalization stage. So as we're coming towards the end of our time, I'm just going to have one last question and just a quick response from our panelists. And I know Veilahi's still online. If you can, that'll be great. The last question is, what message of encouragement would you share with Pacific youth or families or even our clinicians or researchers about the future of medtech or health technologies? So I'll say that again. What message of encouragement would you share with our Pacific communities across the whole ecosystem about the future of health technologies or medical technologies? Maybe I'll start with Soteria, Candice, and then Sandra.
I would encourage you to be involved when the opportunities come up for our Pacific people, with people like us in these spaces now, helping to provide information and encourage you to have a look at solutions for your own families. They can be, think about the fact that they can also be potential areas of innovation and entrepreneurship. The simplest thing that you may use in your home could be the simplest form of technology for your own family. And that's coming right down to the basics of what is around our homes and how we traditionally look after our families. They're not necessarily bad things. They actually should be encouraged, especially that historical ancestral knowledge, that generational knowledge that you have. They shouldn't be laughed at. I would encourage you to consider all of those areas that are already inside your home.
Absolutely. Candice?
I think Soteria has said a really good message for our communities, and is from a provider's perspective to another provider or health workforce. Technology is not scary. In fact, we always, and I'm saying that from us adopting AI and just going on, because we, sometimes we can get so bogged down with the what ifs, and people are not gonna I'm not gonna, there's gonna be a low uptake, all that stuff. But I think what we always forget is that when it's led by Pacific, because we know and we've got our Pacific frame over things, and it's trusted faces, and people will easily, adopt it. So I guess just the future is now. We can't look another 10 years or another 5 years. And technology is changing, and it keeps changing every 2-3 months. So
Absolutely.
for us to the scale of change, we need to adapt now and pivot very quickly.
Thank you, Candice. Sandra?
Just coming from the university perspective and acknowledging the wisdom of Soteria and Candice. So for students, I guess, just take up every learning opportunity you can find. So whether it's a uni course or it's an online training, so there's like Coursera or Udacity, or you can just teach yourself on YouTube or an LLM. So find a problem that needs a solution and have a go at solving it. So collaborate and network. So I think, as I mentioned earlier, it's impossible for one person to have all the skills that you need. So identify people that share your values, same values and aspirations, share your idea and seek feedback. So it's always good to get validation. So you never know which conversation might lead to a funding opportunity, or just even to give you some advice to strengthen your idea. So you can and should lead, and a strong believer in by Pacific for Pacific.
Beautiful. And Veilahi, if you're able to maybe share some last thoughts. If not, then that's okay. But we'll...
Oh, sorry. Yeah, is it working?
Yep.
Yeah. For me personally, for our people, especially the Pacific communities, particularly, I know for our elders, it is kind of like a topic where, or like a tool where it's quite hard to navigate around. So it's like areas that we could like make it simpler for them just to follow, just so we're all connected to pretty much on the same topic, pretty much. And yeah,
Yes,
that's
sir.
pretty much.
Thank you, Veilahi. Well, to everybody that's joined online, Voilahi Mahaki, Whawhai Tele Lava, Maloa Pito, Ngā mihi mahana. Thank you for all being part of today's webinar. I want to thank our speakers, Sandra, Soteria, Candice, and Veilahi, for sharing your expertise, your experiences, and your vision. You have shown us that, innovation's not just about new technology, but it is thinking about how we can make health more accessible and how we can improve health equity, especially for our Pacific communities, and keeping at the core our values, especially maintaining the community lens and Pacifica lens. To everyone who joined us online, thank you for your questions, reflections, and the time you've given to be part of this important talanoa over an hour and a half. And the strength of health innovation definitely lies in our collective effort, listening to our communities, learning from each other, building up the right team, and ensuring our Pacific peoples are not just included, but leading across the whole spectrum end to end. And as we close, I leave you all with a challenge of how can each of us take what we have heard today and translate it into action, whether it's within our organizations, our communities, our schools, or our own households. So on behalf of our organizing team, thank you. Please stay connected with us as we continue these conversations. We look forward to sharing more positive changes related to medical technologies, especially when Pacific innovation is leading the way.